Hi, I'm Susan Koenig, and Danny Burke, the new editor of the Soma Times, asked me to make a video of a movement pattern I've been working with that deals with a very, very common contraction pattern. And I'm going to stand up to show you the pattern. It's when the low back is contracted and the hip flexors are contracted. I'm going to sit down again and just talk a little bit about one of the reasons this comes about is because we sit for long, long hours. Looking at the computer, often our head goes forward, we're looking at the screen, it brings our upper body forward, we overcontract our lower back, and you can possibly see that that actually increases hip flexion. And then after hours and hours we finally stand up, so I'm going to stand up again and I'm going to exaggerate what happens. And I'm going to turn to the side so you can see me better. So we stand up and we think we're standing up straight, and I'm going to turn to the side. So we might look like this, and I've actually got a little hip flexion left, but I'm going to exaggerate and put a little bit more in. We stand up, we think we're straight, but we're not really straight because our hip flexors have been short for so long that they don't completely lengthen. Then when we straighten our back, it hyperextends our back. And then we walk around with this hyperextended back, the back in contraction, the hip flexors in contraction, and this represents a co-contraction, and it creates stiffness in the back, in the pelvis, in the hips. It impedes walking. So here's a simple movement pattern that I've begun to incorporate in my daily cat stretch on the floor. And I'm sure many of you can come up with wonderful movement patterns as well. But here's the one I like to do. So I'm going to lie down on the pad now. And what I like to start with is a little bit of warm-up and some arch and flatten. You can do that on your own. I'm going to go right into the contraction pattern. So I just mimic the pattern I just talked about. I gently arch my lower back and I hold the arch. I'm going to take my right hip flexors and flex them more. And then I'm slowly going to release both my low back and my right hip flexors and just lengthen my leg to let them lengthen out more. And in between each set, I'm going to do an arch and a flatten. And then I'm just going to bend my leg and start again. Arch, flex the right hip, slowly release, lengthen the hip flexors on the right, do an arch and a flatten, and one more time in keeping with our 3 sets. Arch, hold the arch, hip flexor contraction on the right, slowly release both, lengthen out the hip flexors even more, and take an arch and a flatten and relax. Now this is the one I most commonly use, but sometimes I do a variation, and I'm only going to recommend this variation, which I'll show you on the left, if you feel your back can handle it. If there's any pain, of course, go back to the first one. On this one, I arch and I increase hip flexion on the left, but as I release, I straighten out my leg, so I'm straightening out the hip flexors with just a little bit more lateral rotation to get into the psoas a little bit more, but I still do the arch and the flatten. I still like to come from this starting position, and I'll do it 2 more times. Arch, hold the arch, increase hip flexion, slowly release both as you straighten the left leg, straighten out the hip flexors, slowly put the leg down, rest, arch, flatten. And then last set, inhale, arch, increase hip flexion, and then release, lengthening out of hip flexion, slowly come down, let everything relax, and one last arch and flatten. So, I hope you try this out, and I bet you can come up with many, many wonderful movement patterns to release this co-contraction that affects the low back, the hip flexors, the deep psoas muscles, and maybe you'd like to submit either in writing or in video your way of dealing with this pattern. All you have to do is contact Danny Burke of the Soma Times. Thank you.